My name is Dr.Life, and today I would like to talk about a subject very near and dear to me, a subject that is really kind of kept under wraps. That's why I call it the elephant in the room. It's about alcohol misuse and abuse. The pandemic that we have gone through over the last year has really bolstered the amount of alcohol that people consume. As a result of the isolation and social distancing, we have dramatically increased alcohol misuse and abuse. Alcohol abuse is the third leading lifestyle-related cause of death in the United States. It comes after tobacco use and unhealthy diets and or lack of exercise. So what is binge drinking, which has become a real big problem in recent years? Binge drinking is defined for men as consuming 5 servings of an alcoholic beverage within 2 hours. For women, it's consuming 4 servings of an alcoholic beverage within 2 hours. I don't know about you, but sometimes that was just getting started. Binge drinking is the most common, costly, and deadly pattern of alcohol use in America. 1 out of 6 adults binge drinks at least 4 times a month. In other words, just about every weekend. Binge drinking happens more among people with household incomes of $75,000 or more. According to the CDC, in 2013, nearly 1.4 million people under the age of 20 participated in heavy drinking practices, consuming 5 drinks or more at least 5 times in a single month. This is people under the age of 20. So what is heavy drinking? For women, it's 8 or more drinks per week. For men, 15 or more drinks per week. Moderate drinking for women is 1 drink or less a day. For men, 2 drinks or less a day. So what is a standard drink? 1 12-ounce beer that's 5% alcohol is a standard drink. 8 ounces of malt liquor, 7% alcohol, is a standard drink. 5 ounces of wine, 12% alcohol. And 1.5 ounces of distilled spirits, in other words, 40% alcohol or 80 proof, consist of a standard drink. Alcoholism is one of the biggest health crises in America today, and it has been for generations. 70% of men and 8% of women meet the criteria for alcoholism. So what are the short-term health risks of excessive drinking? Injuries. This includes motor vehicle accidents, falls, drownings, burns, and the list goes on and on and on. Violence, which includes homicides, suicides, sexual assault, intimate partner violence. Alcohol poisoning, risky sexual behavior, which includes unprotected sex and sex with multiple partners, miscarriages and stillbirths. What are the long-term health consequences of excessive drinking? Hypertension, which is high blood pressure. CAD, that's coronary artery disease, which leads to heart attacks, strokes, liver disease, and digestive problems. Cancer of the breast, of the mouth, the throat, the esophagus, liver, and colon. Weakening of the immune system, which puts people at increased risk for becoming infected with COVID-19 and other infectious diseases. Learning and memory problems, mental health problems, depression, anxiety, social problems, alcohol use disorders or alcohol dependency. Signs of alcohol use disorder. So if this is a questionnaire, and I encourage you to Fill this out, answer these questions, and then look at your score at the end and see where you fall into the three categories at the end. So the first sign of alcohol use disorder is you've had times where you ended up drinking more or longer than you intended. Number 2, more than once wanted to or tried to reduce or stop drinking but could not. Number 3, spent a lot of time drinking or being sick from drinking. Number 4, wanted to drink so badly that you couldn't think of anything else. Number 5, found that drinking or being sick from drinking often interfered with work, family, or social duties, or your significant other relationship. Continued to drink even though it was causing trouble with your family or friends, wife or husband. Number 7, have given up or cut back on activities that were important, interesting, or pleasurable to you in order to drink. 8, more than once gotten into situations while or after drinking that increased your chances of getting hurt. 9, continue to drink even though it was making you feel depressed, anxious, or adding to other health problems. 10, had to drink much more than you once did to get the effect you wanted. In other words, you have it's lost its effect on you, and so you have to consume a lot more. Number 11, found that when effects of alcohol were wearing off, you had withdrawal symptoms such as trouble sleeping, shakiness, restlessness, nausea, sweating, racing heart, or a seizure. Signs of alcohol use disorder. So if you answered yes to 2 or 3 of these questions, you have mild alcohol use disorder. If you answered 4 or 5 questions yes, you have a moderate alcohol use disorder. And if you answered 6 or more yes answers, you have a severe problem with alcohol consumption. And I will add, you need some help, maybe a lot of help, to get through all this and get on top of it. So this is my talk on alcohol use disorder. And if you have questions that I can help you with, please let me know. I have been through all this myself and am alive today and fit today because I've been able to overcome all this and deal with it in such a way that actually the way I've dealt with it is I just don't drink anymore. So let me know if you have questions, and thank you very much.